If you want to know what's going on in Rockingham County government, check out Rockingham County 411. If you're interested in county governmental programs, projects, and services, don't miss Rockingham County 411. Public Information Officer Mabel Scott will share important, crucial news you can use with Rockingham County 411.
Rockingham County 411. You're in a good place. This is Mabel Scott, your County Public Information Officer, and today we're going to be talking with Dr. Shastri, and she is the dentist here in the Public Health Department. She is the dental director for Rockingham County's Public Health Department. And wait until you hear about all the things that she and her team actually do. Welcome to Rockingham County 411.
Thank you, Mabel.
Tell us, what is the Rockingham County Public Health Dental Clinic?
Well, Rockingham County Public Health Dental Clinic, it started, I believe, in 1999.
Okay.
It was working as a free clinic in the beginning at different location. Then they moved to where we are right now in about 2002. And since then, they have been here helping our county people meet their oral needs.
Good, good. So where exactly is the dental clinic?
So dental clinic is in government center. We are on the second floor of the government center. There are signs, once you're there are signs that will guide you to go and find us.
Okay, and the governmental center is located at 371 NC Highway 65. We're right across the street from Rockingham Community College. And then, as she just explained, the dental clinic is on the second floor. But before you do all of that, as far as actually coming to the dental clinic, should we make an appointment?
I would encourage to call us and make an appointment. Our number here is 336-342-8273. And people can call us, and my wonderful staff here can help them make appointment and schedule them.
Okay, what ages do you serve?
That's a really good question, Mabel. We start seeing people when they start getting their first tooth to 90, 95, 97, as old as you can get.
All right, great. So everybody is invited?
Everybody, yes.
Good. And what dental services do you provide?
So we do provide comprehensive care that begins with exams, radiographs, cleaning, extractions, dentures, sealants, fluoride, even root canals, crowns, bridges, and emergency treatment as needed basis.
Oh boy, dentures, just everything.
Just pretty much everything.
Everything. And how much is all this going to cost us?
That is a very good question, Mabel. It all depends on the person's individual need.
Okay.
Based on that, and also it varies as per their coverage, because we do accept Medicaid and health choice.
Okay.
So that will help in financial assistance for those things. We do accept private insurances like Delta and Cigna. So that depends on your coverage program. If you're 80-20, 50-50, whatever that is. For people who do not have any coverage or any program they're enrolled in, we do have a sliding scale option, which helps them like a financial assistance and reduces the total fees to 60% or 80%. And that is decided based on their income level. So they need to bring some income proof, and our staff here can help them come up with the proper treatment number.
So as you said earlier, you are able to treat a wide range of people who live here in Rockingham County, and no matter what our pocketbook might look like.
We are here to help.
Thank you. We appreciate that. Now, what actually is in the dental clinic, and what does it look like?
So dental clinic, as you walk in, you will walk into our waiting area lobby. There are current changes because of this COVID situation. So we have limited the chairs and sitting, but we have like nice big lobby. From there you enter and see our front desk staff. Going further, there's doctor's office, hygienist, operatory, our treatment room, sterilization, break room, mechanical room, wait till you see all those pictures.
And the slides and the photos that you're seeing during this video, you and your team shot for us so we could show in this video. We
Yes.
appreciate that.
Yes, I would like to add that we recently, beginning of this year, we remodeled the place and gave it a new look. And we have been getting really good compliments from our patients with that comfort looking and some energetic look in the place.
The colors, how did you all choose those beautiful colors?
Well, our team came up with that. So it all worked out well.
Very relaxing and bright and vibrant, and they kind of just let you know you're welcome.
Yes,
You're
that was the
welcome.
whole purpose.
Yes, inviting.
Yes, we want people to feel at ease and comfortable coming and getting their treatments.
You're right, because sometimes some people, when you say dentist, they go
Oh,
dun
yes.
dun dun dun. Yeah, yeah. So who works in the dental clinic and who's part of your team?
So I would begin with Michelle Bose. She's our hygienist.
Mm-hmm.
She has been here with us for about 14 years. She takes care of people's need for cleaning and fluoride and those things, and radiographs as well. And then we have dental assistant and front desk person who is Natasha Crawford. She has been here for a little over 15 years. She is a wonderful asset for us. And so is our another member, Priscilla Hernandez. She has been with us for about 8 to 9 years. And I have the best team, I would say. I'm fortunate to have them.
Yes, and you all stay booked too, so people need to call.
Yes, they need to call. And we try to be available in case of emergency, but we always encourage to call first thing in the morning. Don't wait till 4 o'clock when we are ready to close, so that we can get you in, if possible, that same day, if not the next day.
Okay, okay. Tell us a little bit more about you. Tell us about your educational and professional background.
Well, I was born and brought up in India.
Uh-huh.
After completing my dental education over there, I moved to US as foreign educated dentist. Then I did my Masters of Healthcare Administration, MHA, in Texas. From there, I continued my career in dental with USC, United States of California,
Uh-huh.
in USC school, University of Southern California.
Yes.
Yes.
I have friends who have children at that school.
Yes, so from there, I moved to New Mexico and I worked to help underserved population in New Mexico for about 6 years. And I have been with wonderful North Carolina and Rockingham County since last 2 years almost.
How did you all even choose North Carolina and Rockingham County?
Like you said, it is a good place.
It is, it is.
It is a wonderful state. We wanted to be close to family and still have a place where we can do outdoor stuff and still feel like home. So I think North Carolina was the best choice.
The
So was this
perfect
county.
match. It was a perfect match.
Yes.
And when and why did you decide to become a dentist? Was this something you talked about as a little kid or when you were playing with your dolls or?
I think I was, but I for sure remember at 9 years of age, I knew that's what I will be. My father's friend, Dr. Ravel, he was a wonderful dentist. He is a wonderful dentist. And he had very good influence on me. I was always fascinated by the stuff he could do with people and how he helped people change their lives. So since 9 years of age, I knew I want to be like him. And from then on, it went and I shadowed him. Then I got some other experiences. I'm like, okay, dentist it is.
And you all help us so much because you help us to smile better.
That's true. Smile is most important thing.
It
It is the
is.
most precious.
It is. It's very, very precious. So why is prevention important? And I think earlier we heard our videographer talking about flossing, and I said, listen to Roy.
Yes, prevention is, we have always heard, prevention is better than cure. By the time you get to the level where you need cure, that means you have some issue already and now you're trying to fix it. It is way better to prevent it before you even get there. Because sometimes even if you fix, it's still not the whole thing like it was before. cure needs more time, more effort, more money, more pain. Prevention is usually way more easier than all this. But you have to remember, prevention has to be consistent. If you do it one day and then don't do for next 1 month, it's not going to help. So consistency is a key in prevention, but that can keep you away from so many troubles.
And some of the prevention tips, I know, don't eat a lot of candy and floss and brush your
Yes.
teeth,
Yes.
drink water.
So, people mostly know these things, don't eat sweets. They know brush. But the thing that we need to keep in mind is brush, but do properly and get everywhere. Doing just front teeth, doing just one side will not get the results. So do it everywhere, circular motion constantly. Flossing, yes, go round and round and
Okay.
round like that.
Okay.
Outside, inside,
Okay.
on the chewing surfaces, up, down. Like, and sing a song if you can. In your mind, just hum. Do 2 minutes. And I'm sure people know all about this because they have been hearing it for years and years.
We have.
But flossing is important. And like you mentioned, don't eat candies, which is difficult. Believe me, I love candies. But it's like how often you do it. If you have habit of like sipping through that cup of energy drink all day, you will get more damage than you sit and finish it in one time. And then you go and brush or rinse or drink water.
I've never heard that before.
That's the thing. So it's not what you eat is important. Along with that, another important part is frequency. Number of times you get exposure to those things. So we might have person eating five candies in a day, all at one time, and on the other side, eating every hour. The other person has higher chances of getting damage. Well, of course, there are so many other factors that will contribute to this, but frequency is very important.
Boy. So all of what you're saying will help us to prevent from getting cavities and
Right. So, like we discussed, brushing, flossing, watch your diet, what you are eating. Go to dentist regularly because it's better to catch cavity when it's in the beginning than you wait till it starts hurting. Because most of the time when it starts hurting, it's too late. Then you have to make that critical decision. Do I get it out or do I need a root canal and spend a lot of money on it? But if you are getting regular checkups, you catch it in the beginning where it is tiny cavity, can be fixed in few minutes. And then you can just maintain it.
okay. You talked about our dental tips. Before we ask you for any parting words, I'd like to just ask, why do you love your job? Because we can tell you really enjoy what you do.
Yes, I do. Well, we do make difference. And when I say we, I don't mean just me or my team. I'm talking about our entire dental community. Oral health is very important. It does affect our overall health. There are so many research and study which can prove having bacteria in your mouth or gum diseases can lead you to worse condition with your diabetes or high blood pressure or even pregnancy can get significantly affected. So I feel fortunate that I am here to tell people what else can help them make their life better and improve their overall health and well-being. So,
And that's what we're all looking towards.
yes.
Better lifestyles,
Yes.
healthier lifestyles. And it can begin with making sure that we take good care of our teeth and that we listen to many of the suggestions that you have given us today. This has been a great interview. I've learned a lot. And you just told me that what I need to do is, if I'm drinking an energy drink, to drink it all at one time, as opposed to sipping all day long.
Right. First of all, I would say, well, if you don't literally have to, don't drink those drinks too often.
Drink more
Make
water.
make educated decision. Those bottles have everything on it that you need to know. Find out if you really want that much sugar in it. And I'm not saying don't drink all those things, but decide what you really want for your life. Reduce the exposure, like you just mentioned. And I would like to give a few more tips regarding that.
Okay.
Number one, the most important thing, especially for parents out there, try to make your kids' first visit to the dentist as recommended by the board by the time they have their first tooth in the mouth. After that, make a habit of taking them to dentist regularly so they will learn that and they will continue for all life. Apart from that, you are making good habits in them. They see you, they learn from you. If you are doing good job brushing every night, they would learn that I have to brush at night. Because it's important to brush in the morning, but in my opinion, the best thing is to brush at night, and that is must. Because when you go to bed, you are not eating or drinking. You don't have enough saliva in the mouth to wash out all the food. So that food sits there if it wasn't brushed and taken out. And those bacteria have party all night. So if we don't want that, brush at night and make your kids do that. Make it a habit. And they will thank you for all their life after that. The next thing is, like I mentioned before, our mouth and body is connected. Understand that, and once you take care of your mouth, your other problems might improve too. And vice versa. If you don't take care of it, other symptoms might get worse. So take care of that. Follow all the good hygiene habits, what you eat, and make a good decision.
Make a decision, good decision, and think.
Yes.
Yes. And your body, your life is really your treasure.
Yes.
And your health is wealth.
It is. You are so right, Mabel.
Yes, it is. We want to thank you for a great interview. We're learning so many new tips and what
Thank
we
you.
can do. And thank you so much for being
Of
here, for
course.
serving Rockingham County citizens. Dr. Shruti Shastri.
Thank you, Mabel.
Thank you for all you do.
Of course. And this, I should say thank you to you and this county. We are fortunate to have dental clinic in our county, so our people can get service right here for all their needs. So thank you for our county commissioner, county manager, and to our board for making this decision and supporting us. Thank you.
Rockingham County, you're in a good place.